number 6 and number 7 myths. If you have back problems when you're young, they'll get worse as you age. And number 7, you should expect it to hurt, it's your age. So I'm answering both of those together because they're kind of similar. But it's a really common conversation that, oh geez, my back's like this now, what's it going to be like in 20 years' time? Well, thankfully it doesn't necessarily follow that things get progressively worse as time goes on, thankfully. And similarly, age isn't necessarily the big factor, and I'll explain what I mean. And bundled in together with these two are an investigation will show what's wrong with your back. If I better have an MRI because that'll show me what's wrong, that'll show me what's hurting. And along with that, the findings on your MRI need to be cured to be pain-free. Something needs to be cut out or fixed or cured for you to be pain-free. And thankfully that's not true either, so I'll explain what I mean. So the highest incidence of back pain is between 35 and 55, which is really interesting. So as a rule, in the prevalent studies of back pain, people have less pain after 55. The onset of new back pain, at least, is less after 55. And it's especially with disc-related disease. And that's not to say that people over 55 don't get back pain. That's not what I'm saying there. But the rate of pain that's experienced doesn't get progressively more and more and more as time goes on. And I think that's a really nice thing to remember. And on top of that, if you deal with an episode of back pain well, there's no reason to think that you can't have and recurrences are going to happen, but you can't have a good, healthy, functional, meaningful back. And the trick is to do the right things and to learn how to manage it independently. Learning how to manage your back independently is really critical. Age-related changes to all tissues are quite normal. That's a fact. Like it or not, things change as you get older. And you just have to look at skin as an example of that. You look at your skin and compare it to a 2-year-old's skin, and they're quite different. But you wouldn't necessarily say that's a degenerative change. That's just an age-related normal change that happens through life. And all tissues are similar to that. Everything we're programmed to change. Disc degeneration is quite a normal process. But luckily, age and the normal age-related changes don't necessarily match to pain. And even though that might seem a bit hard to accept, hopefully this next study might explain a bit better what I mean. So this was a study from 3 years ago now, where they bunched together a whole lot of studies, and they were MRI studies on people that had no pain. I'll explain it as I go along so it'll make a bit more sense. So they bunched together all these studies. I can't remember the exact number, but it was a significant number of subjects, and they calculated from that the prevalence of certain spinal problems in people that were asymptomatic, that had no pain. So for example, if I look at my age group here, I'm in the 40 to 50 age group. Of people that had no pain, 68% had signs of disc degeneration on MRI. That's staggering to me, that you could have a whole bunch of people that have no back pain, scan their backs, and 68% would have signs of disc degeneration. It's amazing. And you've got, when you look at this table, you've got to remember these are all people that have no pain. So 68% with disc degeneration, 54% with disc signal loss, 45 with disc height loss, half of them have a disc bulge, a third of them have a disc protrusion. You know, they're big numbers. And so the problem is, you go away and have an MRI done or a CT or something, or an X-ray, and you come back with the results and you read it and it says, oh, I've got a disc bulge. Well, hang on. Half the people my age have a disc bulge regardless of whether they've, you know, the asymptomatic bunch have got a disc bulge. So it really puts a completely different spin on the investigations that are done when you look at a table like this. I'll print this off. I'll give everyone a copy of this afterwards because you might want to have a look at your age group in a little bit more detail to see what the rates are in your age group. And this is just displaying it in a different format. This is a gay pride chart here, a rainbow, sorry. It's a rainbow colour chart, and so each of the age groups, 20, 30, 40, 50, but you can see that the changes increase in with each age group. So what starts out as, what do we got here, 30% in 20-year-olds for disc degeneration, progressively gets more with age. Bear in mind still, these are all people that have no pain. This is an asymptomatic population. So all of these changes are normal changes that happen progressively more and more through life. And so you have to think to yourself, are these just normal changes? These things that you read on the results that they talk about degenerative changes, are they just normal age-related changes? It's interesting. So age-related changes doesn't mean that they have to be painful, is the bottom line. I hope you're with me on that now. And in fact, only a minority of low back pain should have MRI scans or other investigations. And the treatment guidelines are pretty clear on that they say MRI should be used in situations where there's a prospect of a change of treatment approach. If they scan this person, it might actually direct which way treatment will go, or if there's a real concern about something serious going on, a serious disease, which they often refer to as red flag conditions. Now, a lot of those red flag conditions you can pick up in a clinical examination or by talking with screening people with certain questions that will pique your interest. So physios and other health professionals are well educated on those kind of screening questions. So when a study came out in March of this year, a couple of months ago, from The Lancet, that talked about low back pain as a global problem, one of the authors was interviewed and she talked about the downstream effects of imaging, and I thought it was a really interesting thought. And what she meant by downstream effects is, so let's say for example you have a scan of your back and it shows something on the scan, on the results. As we've seen, it doesn't necessarily mean that has to be a symptomatic finding, it's just a finding. But you can't kind of unread the report, you can't unsee it. Once that finding's is on the report and it's been read to you, or you've read it yourself and you've Googled about it, you can't undo that. And so it would be reasonable to think that if you were a 40-year-old who found they had a disc bulge in their back, as 50% of the asymptomatic population will have, that you might think a bit differently about your back and about what you should be doing and about the pain that you've got. So the downstream effect is that it can actually create issues and beliefs, change your beliefs about your back. And so it's a really good reason for a lot of people not to have scans. And the problem is that the average person talking with their colleague who says, so have you had an MRI, you've had your back pain for 2 weeks, have you had an MRI done yet? And they go into their GP and say, I want to have an MRI on my back, and the GP's in a really tough position there. They want to do the right thing by you, but they know what the guidelines are. And so I can see how it's a really tough bind to be in. But the guidelines actually are actually a lot more restrictive of who should be getting MRIs. I think it's good to know that, so that you don't go in there and bang on the desk at your GP next time you got back pain.